Okay, good. So let's start. We have station 1. We need the first candidate here. في حد بيحضر معانا لأول مرة لسه؟ Is there any first time attendees here? Somebody who's attending with the first time with us?
Yes.
Who are you, Erika? Erika,
Yeah.
right? Erika?
Yes, that's my name. Yeah.
Erika. Okay. You know how it works here?
No,
Have you
I
listened
do not.
to-
No, I do not.
You do not. Okay. So Gazuri, can you give an overview about how it works in our sessions for the newcomers here?
How it works أنا مش عارف how it works أصلا.
يلا يا عم قول. بتمشي ازاي؟ النظام بيمشي ازاي عندنا؟
ده نظام كمان تحطني في موقف عشان okay guys, so we have like live sessions. Every candidate we're gonna participate. If the first candidate didn't pass, we can either explain the station or we give another chance for another candidate and so on. At the end of the day, it's we're gonna post the recorded sessions. Okay, and you have to get enrolled in the WhatsApp group because we send usually during the session we usually yes, if you can participate. We usually send the references in the WhatsApp group so you can participate in the live sessions. Okay.
Okay. Anyone who wants to participate in the live sessions, please, you can raise your hand.
Yes,
so we
me.
can see you. Okay, you would kindly please raise your hand so we can see you. Okay. So what we're gonna do now? We're gonna take one station one by one. Usually we have around 6 stations per session. Okay. We try with the first candidate. If the first candidate got the right solution and completely solve it, we proceed to the second station, and etc. If the first candidate did not solve the station in the right way, so we have to retake it with another candidate. We make two attempts per one station as maximum 2 attempts per station. Okay, that's it. At the end of each station we make like we do the assessment. We discuss what was the correct points, what was wrong, and etc. How to ameliorate the solution and the scheme. I don't know if you have an idea about our scheme as well. We have a scheme that we call the SOS, Systematic OSCE scheme. You can find it in the RX course platform. You can make a subscription to rxcourse.com. You will find the PharmaFree OSCE and MCQ courses. You will have all the previous sessions, and as well we have a YouTube channel. Search on YouTube channel for PharmaFree. You will find all the previous stations, OSCE and MCQ sessions, and etc. Okay, so let's start now. Whenever you have questions, do not hesitate to ask it. And here I can see 3 candidates are raising their hands. We have Harmandeep Singh. I think it's Harmandeep was the first one who raised his hand. So we will proceed with them. Let's go Harmandeep, right?
Yeah, I'm ready. Actually, I'm working at a shopper, so a bit of disturbance could happen, but I'm ready to go.
You're working in shoppers?
Yes.
Okay, no problem.
Yeah, I'm working as a pharmacist, so let's see. It's very quiet here. Let's see.
It's very quiet, okay?
Yeah.
Are you sure you can take the station?
Yeah, I can take it. It's fine. There is no one here. I can do the station in 7 minutes. That's fine.
You are a technician or a pharmacist?
A pharmacist.
Oh yeah, temporary license or the emergency license, and that's it?
Yes, yes, yes.
Okay, good luck, my friend. Okay,
Yeah, sure.
no problem. Okay, so are you on our WhatsApp group? So I'm gonna send the
No, I don't think I'm on WhatsApp group.
this is a trick. Okay, so you have to pass this station, my friend. I'm gonna send you a link now to the WhatsApp group.
Okay.
Usually, we send the reference to the WhatsApp group. Okay.
Okay, no problem. Just send it to the WhatsApp group, and maybe I'll take the next one.
No problem. Okay.
Okay.
Okay. I will send the invitation now to the WhatsApp group. Whoever is not on the WhatsApp group, please join now so you can see the references. Hold on. This one is almost full.
If you believe that it can be solved without looking at the reference, I can do that.
For first one, let me check, my friend. I do not remember it actually. I believe you may need to look at the reference. Yeah.
Okay, okay, okay. That's fine then. That's fine.
Okay. Yes. Better to check the reference.
Yeah, sure.
Yes. Okay. So you have the invitation to the WhatsApp group now. Okay. So we'll proceed with Dr. Mido.
Okay.
Dr. Mido, are you ready?
يا باشا معاك.
Okay. Here it is. Okay, so I sent
بس انا
now you should have the reference now. Okay. معاكم المفروض reference كده يكون وصل يا شباب. يلا بينا.
should I start with the first station?
Yes. Are you ready or you
Okay,
wanna pass
sure.
it? Next station, Harmandeep, you will be with us, okay?
This is a reference, just one second.
Yeah, one moment. Gazuli, would you please watch at the time?
I will, no problem. So once he has access to the reference, let me know so we can start for 30 seconds, then you can start, okay?
Can we send the reference here? I don't know. Let me try. I don't know if we
يا
can
ريت
send the
لا
reference here.
عشان يكون اسهل شويه.
No. Oh, لازم افتح. Okay, one moment, guys. I'm trying to send the reference here. I don't know how it works. Okay, yes, it works, I think. I send the reference to the Zoom chat room as well. Okay, so يلا بينا.
لحظه واحده.
Okay, محمد محمد هيبقى معاك 30 ثانية you can check the reference. بعد 30 ثانية يا جازولي اللي أنا ابتدوا ماشي. Okay.
ماشي اوكي.
Okay, 30 seconds and we're gonna start.
Okay, let's start.
Hi, I want to talk to the pharmacist.
Yes, my name is Muhammad, the pharmacist in duty. How may I help you?
Yes, I heard that you have like a smoking cessation programs here. I would like to quit smoking. If you can help me, that would be great.
Yes. First of all, congratulations for your smoking cessation. It's a great step, and I appreciate you your step, and it will affect all your health, and also please have a seat first in our private counseling area. So whatever we discuss today will be kept confidential.
Okay, good.
May I start with your name and age, please?
Yes, my name is Hamo Bika. My age is 33 years old.
Okay, Hamo, welcome to the pharmacy. Yes, we already have a smoking cessation program. Yes. Could I ask you how do you know about our smoking cessation program?
I watched a TV advertising saying that Shoppers pharmacies have a cessation program and something like that. That's why I'm come here.
Okay, that's great.
It was like a TV advertising, yeah.
Can I ask you what is the reason that you are really want to stop smoking right now?
Shouldn't I or what?
It's your preference if you'd like.
I don't like actually.
Okay, that's
I don't
never
like.
mind. Never mind. Can I ask you if this the first time you try to stop smoking, or there is any trial before?
I tried about once or twice before.
What did you try in the last times?
I'd like pills. It was like pills. I don't know, like Zaypan, something like that.
Mm-hmm.
This is the only thing that I tried. I went for it twice, but it didn't work.
The 2 times was the same medication. Is that correct?
Yeah.
Okay, so never mind. It's an experience, and we all learn from our failures. And let's call it an experience, and we will try with another medication, which will be of different mechanism, so you can rely on it. Okay.
Yes.
May I ask you first how many cigarettes you are smoking per day?
I smoke about 30, 35.
30, 35. Okay. And when is the first cigarette you are smoking? At what time?
No, I didn't understand. First,
the first cigarette you are taking per day. It's starting how many hours or how many minutes after you wake up in the morning?
1 minute after.
1 minute. Okay.
Yeah.
So you never saw your doctor for that?
Saw my doctor? No.
Yes.
Why should
you never
I?
tell your doctor that you need to stop smoking or something, or this is the first time you talk to someone about?
No need. He knows that I'm smoking, so I don't need to talk to him.
Okay.
It's my decision, as you said.
Yes, for sure. For sure. I'm asking if you seek a professional help before or not.
No, it was only once because I got prescribed the pills,
the medications,
Zaypan or something like that. Yeah. That was the only one. And he prescribed me, it was, yes, it's my family doctor, Dr. Hani Shakir. And he prescribed me this medication twice, but I don't believe it worked.
Yes, I see. Can I go to your profile with you?
I heard about the batches and something like that.
Yes, I will tell you about all the options right now. I see here through your profile that you are on olanzapine 10 milligram by Dr. Hani Shaker. This was filled last time 19 days ago for 30 tablets. Are you still using this tablet, olanzapine?
Yes, it's for my psychosis.
Okay. Are you use it regularly?
Yes.
Okay, that's great. So actually, Huma, Hamo, you because you are using now olanzapine, my recommendation that the smoking itself, the smoking like an work as an inducer for the for that medication. So when you stop smoking, okay, there will be an effect on the medication you are using. So we need to decrease the dose itself. Okay.
Okay.
So I will fix your doctor about that. So he knows about your smoking cessation. So he will adjust the dose of the medication. But my recommendation, according to the reference right now, that we can start with, as you said, with the nicotine replacement therapy, which is a type of patches to be used. It's actually, we start because you are using 35 patch per 35 cigarette per day. So we can start by using the 21 milligram. Okay.
Okay, good.
So this is the first one, and you will use this patch first. It's like a patch to be put on the body, on the chest, on the arm, or any non-hairy area every day, and should be removed at the night. Okay, so this patch, we will start with this one. After that, we will shift to the patch number 14. After that, to the patch number 7 milligram. Okay, so it's like decreasing in the concentration with time. Is that okay?
No, I didn't understand. What are you gonna do exactly?
Again, we will start with the 25 milligram. Okay, this is the first batch. We will continue for 2 weeks. After that, the 14 milligram. Sorry?
Time is up.
اوكي انا محمد معلش انا انت اوكي الوقت خلص. انت ما قلتش دقيقتين يا جازولي صح؟
انا قلت دقيقتين. قلت دقيقتين.
Really?
Yeah,
2 minutes remaining؟
طبعا. Yes, I did.
مين قلت لمين؟ قلت لنا احنا؟
Yes, قلت لكم انتوا 2 minutes remaining. قلت 2 times.
حد سمعتها محمد؟
يا باشا انا بالعافيه سامع نفسي.
Okay, good. Okay, so it's
I had concern صراحة على البرفورمانس.
I have yes, but we can speak it later, no problem. We can address this later.
Okay, انت الاول اعملها مره ثانيه.
I prefer to go with another candidate, Mohammed. Then we can make the assessment for both. Okay, Harmandeep, would you like to take it?
استنى بس عشان excuse me محمد معلش في
Yes, I'm happy to take it.
في ايمان نجحت اصلا ما اعرفش داخله ليه دلوقتي. ايمان مكار ما اعرفش هي اصلا ايمان خلاص خلصت واخدت الرخصه. مش عارف ايه اللي دخلها تاني معانا. ماشي.
طيب.
Okay.
So yes, Harmandeep, you can.
أنا بعمل ريفرشمنت بس يا جماعة مش أكتر يعني. مش أكتر يعني. الله يبارك فيكم يا جماعة.
مبروك صح. أنا كنت شايفك حاطة بوست على الفيسبوك فعلا.
أنا بس أنا لقيت السيشن OTC فبس لما فتحت لاقية سوستينا ولانزابين وحاجات كده فما فهمتش هو الوضع إيه بالظبط بس بحاول أبقى معاكم يعني.
طيب.
أنا معاكم يعني. ماشي أوكي.
زميلة صيدلانية دلوقتي. أهلا بيك يا
مانيتوبا. ماشي يا عم.
So okay, so Harmandeep, we're gonna start.
Yeah, sure.
Yes, please alert us 2 minutes before the station, okay? Before the station ends. صح جازولي شوية كده في الوقت. Okay, so let's start. Yeah, go ahead.
I can start. Okay, I can start. Okay.
Yeah.
Okay. My name is Harman. I'm the pharmacist on duty. How can I help you?
I would like to quit smoking. I wonder if you can help me.
Sure, I can definitely help you. First of all, congratulations on your decision. Smoking cessation has a long-term as well as short-term benefits. So I will discuss further. Have a seat. And I just want to say that this is a private and confidential area. Everything will be confidential. Okay. And may I know your name and age first?
My name is Ham Mobika. I'm 33.
Okay, 33. So Mobika, how long have you been smoking for?
About 12 years ago.
12 years. Okay. Have you ever tried to quit before?
Yes, twice.
twice. And were you a little successful in that?
No.
No. Okay. Okay. So we don't take it as a failure. It's like a learning experience. We can learn from it and move further. Okay. So to help you better with smoking cessation, I just need to ask you a few questions about your general lifestyle and medicinal history. Is that be okay?
Yeah, sure. Go ahead.
Okay. And how many cigarettes do you smoke in a day?
About 30 or 35.
30 to 35. And which one is the most pleasant one?
The first one.
When did you take your first one?
1 minute after I wake
Oh,
up.
1 minute after you wake up. Okay. And okay. And do you still smoke when you are sick or ill?
Yeah, sometimes. Yeah.
Okay. I can understand. And okay, we have the options available for you. Another thing, I just want to ask: are you allergic to any medication?
No, I have no allergies.
Do you have any medical conditions?
Yes, psychosis.
Psychosis. And which medication are you taking for it?
I'm taking 2 medications in the file. I think you can see it.
Okay, I can
I'm
see on the
taking-
file.
Yeah.
Okay. Olanzapine 10 milligram tablets. You are taking one tablet once a day. And for how long you been taking this for?
It's 3 years.
3 years. Is it working for you?
Yeah, so far so good.
Okay, that's good to hear. And another one is Invega Sustena. So
Correct.
this monthly injection. So this one is working for you. Any side effect I should be aware of?
No, it's only
Okay.
once per month, and that's it.
Okay. Okay, give me a few couple of minutes to gather my thoughts and check the reference before I recommend you something. Okay.
Go ahead. Yeah.
Okay, thank you. Okay, just a few more questions about your lifestyle. What's your caffeine consumption?
Usually take about 5 or 6.
Okay, 5 or 6 cups a day.
Mhm.
And are you physically active?
Sometimes, yeah.
Okay. So I have looked into my reference. As you mentioned that your first cigarette is within 1 minute of waking up. So before going over the counter product, I would still recommend to see your doctor that if we can get a prescription medication.
Why?
Because your dependence, you are smoking 30 to 35 cigarettes a day, and your first one is very close to the waking up. So it means you have like a bit more dependence on cigarettes. The over-the-counter products may not be very beneficial at the beginning, but with the prescription therapy, we can try the nicotine therapy alongside it.
I've tried before the prescription therapy, and it didn't work.
Okay.
So I don't
But
know.
did you try did you try only the prescription therapy, or you try the both nicotine as well as prescription?
Only the prescription one, and 2 minutes remaining now. Okay.
Okay. So my recommendation is we can take doctor into the loop and see what he can recommend. And on top of that, I will recommend something over the counter. Like we can start from the patches. Okay. According to your smoking intake, we can start from 21 milligram patch and then gradually taper it over from next 3 to 5 months. Okay, that's my recommendation at the moment, because the patches are a bit more convenient and easy to use.
Okay.
Okay, and I just also want to take doctor into the loop because when we quit smoking, um, uh, uh, generally the smoking interfere with our lot of medications. Like, okay, so the smoking lowers the olanzapine in our body when we smoke. When we are trying to quit it, there is chance that olanzapine concentration will go higher into the system and may cause few side effects. So after you decide to quit smoke, we need to slightly lower down the olanzapine dose as well. So for that purpose, I would say we need to keep the doctor in loop, okay? And in the meantime, what we can do is you can start to do some self-care measures, like get rid of the ashtray, like smoking as ashtrays from your car and house, and try to minimize the number of smokes per day as much as you can. And try to eat healthy, because there are a few side effects that olanzapine and smoking cessation shares, like a weight gain.
Okay, sounds good. So you're gonna give me the patch, right?
Yes.
Okay, okay, it will be the 21 milligrams per
Yeah,
day?
I'm going to give you the 21 milligram patch, but as I mentioned, it should be good if we take it with the prescription therapy.
What type prescription? What type of prescription therapy that I have taken?
Time is up here. Time is up here.
Time is
Time
up,
is
yeah.
up.
But yes. Okay, what's the prescription therapy you would recommend me? Which one?
Like bupropion. No, we can't take bupropion, and the other one. What's the one?
Champix.
Oh yeah, Champix. Yeah,
There are only two.
Champix.
Okay, is the Champix would be okay with the psychosis or not? There's any problem with the Champix and psychosis? Any contradictions here?
Olanzapine.
Okay, good.
No.
What's the problem with the over-the-counter medications? What's the problem with the nicotine?
But I usually read it that if the first cigarette is within 30 minutes, then we need to start from the prescription therapy, because our score is quite high. What's the score that we measure?
Okay, what the first line therapy for the smoking cessation? What are the first time options we have?
We have all the three options, like the Champix and the combination between the patches and the anything like
NRTs.
And also we can use monotherapy of nicotine replacement therapy patch.
Exactly. So the NRTs here are first line. Okay.
Okay.
Yes.
And by the way, they have comparable efficacy to the Champix. The combination of NRTs have comparable efficacy to the Champix. Okay.
Okay.
This guy is smoking about 30 cigarettes per day or 35 cigarettes per day. His first cigarettes is only 1 minute after he wake up.
Yeah.
Okay. So we have here to give him the combination of NRTs, if you would like.
Okay.
A patch alone would not be sufficient in my perspective. I don't believe a patch would be sufficient, because he will have so many cravings. He will have so many cravings per day. Okay, so you have to give him like gum. Yeah, you have to give him gums, or you can give him the inhalers or whatever you want to give. With the patch, he needs to long-acting and short-acting nicotine replacement therapy here. Okay, this to give him. If you give him both options, so you will give him a comparable efficacy to the Champix. No need to go to the Champix. Okay.
Yeah,
this is number 1 point. The other concern is about the olanzapine, as you said. Both of you have addressed this concern. Okay, you, Harmandeep, and Mohammed, both of you address this concern properly. I think this is the right action. Your assessment, in my perspective, is much better than Mohammed's. Okay, you did the right assessment. You asked about almost all relevant questions.
Mhm.
the allergies, medications, how many smoking, how many cigarettes per day, first, and etc. And you didn't over counseling the situation, or what you say. What we mean here by over counseling, that you are not like, you didn't talk a lot about the failure and what we have to do, unlike what we call the بنسميها يا جدول حاجات اللي هي
The steps like pre-contemplation, contemplation, maintenance.
no no
This
no it's
this
not like
stuff.
that. لا 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 اللي هو ما بيبقى اللي هو بيقول كلام إنشائي كتير كده. في ناس بتدخل بتقول كلام إنشائي كده كتير في الموضوع ده، فاهم؟
It's not customized. You mean يعني صح? You mean like his counseling wasn't customized to the patient, right? Is that what you mean?
يعني بالظبط
Yeah.
كده. Okay, there is a counseling and there is over counseling. Okay, over counseling when you speak like thoroughly about a topic and the patient is not interested about it. Okay, so you have to cut it short. This is what I
Okay.
mean by over counseling. You get what I mean?
Okay,
I
okay,
don't-
doctor, I
I can
just
explain it
opened.
in Arabic, but in English I cannot explain it.
Let me give you an example. Okay, let me give you. Both of you asked if did you have an attempt to like a previous attempt to stop to stop smoking? Both of you actually like asked this question, but and he said, yeah, I had an attempt but I failed. But no one to customize it. No one asked what is the reason that it failed. You know, is it a stress from work? Is it like situation, social situation? No one asked this question. So that's what's called customization. You know. So if you're gonna ask him later, if he, let's say, for example, he told you that, okay, so I changed my work, for example, it was so stressful, that's why I couldn't make it. So you have to tell him when he's gonna start another attempt, you have to tell him to choose the right time for himself. You cannot just say, okay, you're gonna start tomorrow, for example, and blah 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 blah. And keep like directing, like this is the dictation. You mean, that's what I believe. That's what Muhammad means. So just give the steps. I know that theoretically you're doing it right, but in OSCE, this is not the situation. You have to customize your solution. It's what's called like patient care. You have to customize the solutions that you have in your hand, okay, and the tools to fit the criteria that you deal with the patient. For example, Muhammad said, okay, so you're gonna start so and so using the patch, for example. How he gonna use a patch? When he gonna use a patch? Did you tell him that it's mandatory to stop smoking? And they decide, which is the most important point here. You have to pick a date to stop smoking, to avoid any kind of failure in the future. Nothing. No one actually said to pick a date. No one said that, which is a critical point here, right or wrong? I have another concern for Muhammad's performance, which is the question he used to ask is not clear. His English is not clear. He's very fast, and sometimes like he eats the words, so I cannot even understand what does he want or what does he want to like ask about.
This is for me.
Muhammad, yes, Muhammad, you have to be like clear and to slow your like rhythm a little bit.
Time is now 9:56, and the store will be closing in 4 minutes. Please bring all
Okay.
participants to the front desk
Okay,
and
my
have a
friend.
seat. The
شكرا.
store will reopen again tomorrow morning
Yeah.
at 8 a.m.
Yeah.
Thank you.
ميوت him بقى عشان خاطر ايه صداع.
طيب ماشي تمام. هو بالظبط يا محمد، انت بس I will give some assessment to Muhammad in Arabic guys. بص يا ابو حميد، انت برضو بتتكلم بسرعه، انا خدت بالي من الحته دي، وبرضو بتستفيد قوي في الموضوع. دي الحته اللي بتاعت الاوفر كونسلنج اللي انا بقول لك عليها. تمام، ما تستفيدش قوي كده، يعني ما حدش هيسمع لك كده بالطريقه دي. انت دخلت
يعني هو
وقعدت
مثلا كان
تحكي له.
محمد، معلش انا اسف، محمد كان في الدقيقه 4 ونص وما كانش
بالظبط.
لسه قلنا حاجه خالص
No,
ما
we
كانش
don't
في
have
حاجه
her
خالص
here.
اتقال.
No, you just had
Yeah.
me in my car. Okay.
ايفن ما سالش على الالرجي، محمد ما سالش على الالرجي،
We'll give you my
ما
number.
عملش
You can add
assessment.
mine.
ما عملش
انا ما
اسسمنت
عملتش
خالص.
اسسمنت خالص تقريبا.
يا
بالظبط.
Just a second.
دوت
Actually, I'm attending a
الصح
class too on the long side.
Okay.
Just one question, sir. Actually, I checked on the website, like, Framingham risk score. It says if the point is over 6, we need to start from pharmacotherapy. Nicotine, there is a score called a Fagerstorm nicotine tolerance scale. So his score
Okay.
was way above 6.
Okay, so what's the problem?
Yeah, so that's why I recommended the pharmacotherapy.
What if
Pharmacotherapy, you mean
no,
Champix?
Yeah, Champix or the other one. So yeah, those two.
Propion? The
Like
popropion,
the
right?
doctor will
I'm
decide
not
which one
saying,
will
my
go.
friend, I'm not saying Champix is not the right solution, okay? Champix could
yes,
be
but he
okay,
tried it
and there is
before
no
and he failed.
contraindication. No contraindication between Champix and psychosis.
Okay.
Previously, about 4 or 5 years ago, as much as I remember, Champix was contraindicated in psychosis, okay? But now
Yes.
there is no contraindication in Champix,
Oh,
okay? But you still have the chance and have the solution, and your answer will be valid and relevant if you can give NRT to this patient,
oh yeah.
okay?
Okay.
That's it.
No problem. Thank
Okay.
you.
Maisa is asking, is it practical to give 2 patches, 1 patch of 21 and 1 patch of 7?
Yes.
Sometimes, yes, we can do this. Sometimes. It's not recommended, I think. I don't know what about the recommendation, but yeah, in practice, we see it a lot. Okay? It happens.
Yeah, yeah.
And we can
Yeah,
even give 2 patches of 21, by example. Okay, we give
Yeah.
2 patches of 21.
Yeah.
Yes,
The
one more
question he
report.
said, do we have to calculate the Framingham risk score on the spot? In this
No.
station, no. In this station, no. But there is a station, I believe, I come across before, that not to calculate it like exactly, but it give like they may give you like the Framingham score sheet, and it gives you an idea of, okay, this guy is like at high risk. There is another station that hits this point, okay, but not in this station. Okay.
Dr. Muhammad, please, can I ask a question in the last station?
Yeah, shoot it. Yeah.
Yes. Can we go to the patient profile again, please?
Yeah.
Because the patient was on two antipsychotic medication. Is that okay?
Olanzapine and Invega sustain. Yes.
Yes. It's okay.
Yeah.
Okay. So this is like a kick-up for the Invega?
No. What do you mean by kick-up of the Invega?
Because we are using two antipsychotic medication. Is that correct?
Yeah. What's the problem of using two antipsychotic medication?
I know that's it's not allowed.
It's not allowed?
Yes.
What's not allowed?
Just one antipsychotic medication. We cannot use a combination between two antipsychotic medications.
Do you have an experience in a pharmacy?
That's why I'm asking, is it a kick-up before we use Invega or not?
Do you have an experience in a Canadian pharmacy, Muhammad?
No.
Okay, I would recommend you to volunteer a little bit, like even two or 3 hours a week. You will see this prescription easy going, ready to dispense. That's what I recommend. Okay, because sometimes, for example, you're gonna see with us like some prescriptions that theoretically they're contraindicated and I cannot do like together. Like for example, if you check two prescriptions on the lexicon, like for example, methadone and quetiapine, if you put them on the lexicon, they will give you an X, red X. That means they cannot like severely contraindicated. QT prolongation, and you can put the guy on death, okay, on the spot. However, it's a very common prescription. How come it's a very common prescription? Methadone patient can have psychosis, can have like depression. So quetiapine, and they can have insomnia as well, right? So quetiapine, it's like kind of hit two, like 2 birds with 1 stone. Quetiapine, it's like a psychotic medication, plus it helps him sleep, right? So before they give it, they do ECG, and then they give it. Okay. However,
Okay.
on theoretic basis, Muhammad, it's contraindicated, but it's a common prescription, you know. So I
There's
recommend
no contraindication. No contraindication. It's a common
yeah.
practice. Okay.
It's a formal practice, my friend. Okay. So I recommend it would help you a lot in OSCE. So you can see, you can listen, you can hear more about like counseling and stuff like that. Okay.
Okay.
Okay, my friend.
محمد انت اول مره تدخل
station
الاوسكي
number-
مش كده؟ انت داخل اوسكي في شهر 5؟
المفروض
انت اول مره
تمام.
تخش الاوسكي صح يا محمد؟
اول مره.
طيب
بتعمل براكتس يا ابو حميد ولا ايه؟
اعمل براكتس مع حد يا محمد. ماشي.
بعمل، بس مش عارف باجي معاكم بعمل كده ليه، مش عارف.
لا عادي.
انا لسه عايزه اقول، والله لسه عايزه اقول ده حاجه ده مش هو ده الطبيعي خالص.
لا نو هارد فيلينجز، احنا هنا كلنا بنتعلم عادي يعني، مفيش مشاكل. اوعى تزعل من حد بيقول لك تعمل حاجه ما
لا
تعملش
لا
حاجه.
خالص 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 اطلاقا.
كلنا هذا
انا
الرجل
بتعلم.
يعني. يا اكزاكتلي. بس اي وود ريكومند انك انت تقف في صيدليه كده شويه يعني.
اوكي ماشي يا دكتور.
اوكي.
ماشي يا حبيبي. لو عندك اي سؤال، بص يا ريس، انت معاك نمرتي ومعاك نمره محمد، احنا على الواتساب. لو محتاج مني اي حاجه اني تايم كلمني اني تايم. خلاص.
ما انت عارفني يا باشا، ما انا محمد عبد السلام.
ايه ده يا محمد ايوه يا عم انا عارفك صح، انت كنت معانا في الام سي كيو مره من زمان لما قلت لك انا محمد عبد السلام برضه انا كمان.
تمام يا محمد.
صح؟
طيب
ايوه صح
يا عم انت مش غريب يا عم، في ايه؟ خضتني.
انا فاكر
ماشي.
محمد صديق البرنامج يا جماعه، ده محمد صديق البرنامج.
ايوه يا عم.
ده ارمي اهو.
ماشي.
رجعت يا
ده
ارمي.
ارمي يا صوت.
Guys, I don't understand what's happening.
ستيشن 2 دي.
كل سنه وانتم طيبين يا جماعه.
وانت
أهلاً
طيب يا
بكم.
حبيبي، وانت طيب. ده سنه
انت
طيب
طيب
عليك.
يا باشا.
سلام.
اوكي
انت عارف
جايز
ان ارمي فطر النهارده المفروض.
ارمي صايم يا
لا
عم.
فطرت امبارح.
امبارح. ماشي يا عم. هابي ايستر يا حبيبي.
عليك يا
هابي
أرمي.
ايستر.
ميرسي يا دكتور، رمضان كريم علينا جميعا.
حبيبي. طب يلا هو شيلنا ستيشن 2 بقى كده يا ريس.
Okay, so let's get back to our work, please. Okay, we have some station number 2. We need candidates. Nicotine patch daily dose, a referral for doctor, or is just yes, more than 21 referral. Yes, exactly. Okay. That's yeah. In some cases we see 2 patches of 21 milligrams. It happens. Okay, but you have to refer. More than 21, you have to refer. We are all saying Mohammed, by the way. You all okay? You are all good, my friends. Mohammed is not bad. He was excellent, but he, as I said, my concern to him is about the over counseling. Okay. So let's. يلا بينا. Is practical to.
دي انا دي ستيشن نمبر 2 دي انا.
Station number 2. I think it's me, my friend. As ممكن تدخل انت stations بتاعتك رقم 4. Okay, so we're gonna jump to station number 4, so Gazuli can take it. It's Gazuli's station.
ماشي يلا بينا.
Okay, we're gonna jump to station number 4.
Niyuma.
Harmandeep, would you please?
Hi.
Yes.
Hi, how are you, my dear? So let's start with the station number 4. Okay.
Thank you.
Okay, no
Sorry.
problem. So
Please, can I have the reference?
Yeah, the reference is in the WhatsApp group.
Yeah, I just joined the WhatsApp group, but it's only the station number 1 that is.
Yeah,
Okay.
reference number 4. I'm gonna share it now. Sorry.
Thank you.
Here you go. This is station number 4. I'm sending it to the WhatsApp group, and now I will send it to the Zoom.
Okay, thank you. Okay.
Okay. There you go.
محمد عيد
Now on
30
Zoom.
ثانية
Yes, okay. So
30 ثانية يا محمد.
good. Yes.
30
Okay.
seconds.
Let's start. You have 30 seconds now. 30 seconds, then we're gonna start.
Okay.
Go ahead.
Hi, I'm Norma, the pharmacist on duty. How can I help you?
Hi, can you please help me? I need some Olex behind the counter. The stomach medication, like the stomach, like omeprazole, I believe. Someone told me about it, that it's gonna relieve my heartburn.
Okay. I can definitely help you with that. Please take a seat in our private counseling area so we can discuss a bit more, okay?
Okay.
All right. So to better assist you, may I ask a few questions?
Yeah.
All right. What's your first and last name?
Leslie.
Okay. How old are you, Leslie?
I'm 45.
45 years old. Leslie, are you by any chance pregnant or breastfeeding?
No.
Okay. And I see that I have your profile right in front of me. What medical condition do you have?
I'm a drug addict, and recently I got diagnosed with Hep C.
Okay. Okay. I'm sorry to hear about that, and I'll try my best to help, okay?
No problem.
Okay. How are you feeling?
I have a heartburn actually. So the reason I have this because I take methadone every day with Tang and orange. So it's
Okay.
like it irritates, exacerbate my heartburn. So I was talking to a friend, and he told me that I can get something like on the spot, like behind the counter or something like Olex.
Okay. All right. So we'll be able to explore your symptoms. So you said you started having heartburn. When did that start?
It's usually right after like I take my drink.
Okay, after you take your drink. All right. And this is like how many days now?
2 or 3 days it started.
2-3 days. Is your doctor aware of this?
Yeah. I told him, and he said I can pick up anything from the pharmacy.
Okay, perfect. And have you tried anything for it yet since it started?
No.
Okay. And then is there anything that makes it better?
I didn't try anything yet.
Okay. All right. So just give me a moment so I can look at your profile again, okay?
Okay.
Okay, Leslie, is there when you touch your stomach, do you feel any mass in your stomach?
No mass, no.
Okay. Is there any fever?
No.
Okay. And then is there any nausea or vomiting?
No.
Okay. All right. Any difficulty breathing?
No.
Okay, perfect. All right. So just give me a moment, okay? So that I can look through my reference.
Okay.
So Leslie, when did you start taking your Epclusa?
When did I start taking my Epiclusa?
Yes.
Okay, I started like actually 3 days ago.
3 days ago. All right. So thank you for clarifying that. Just because you started having the heartburn at about the same time you started taking your Epclusa, I can see, according to my reference here, that there's actually a possible link to the medication you're taking. And it seems like, how long have you been on the methadone?
Long time ago.
Long time ago. And before 3 days ago, did you ever experience heartburn with your methadone?
Yes, sometimes.
Sometimes. All right.
Yeah,
So
the heartburn is from methadone because I usually take it with the thing every
with the
day.
thing.
It's because of the methadone. That's what like I diagnosed like by the doctor. He told me because of the methadone. Yeah.
All right. No worries.
Yeah.
Yeah. Okay. So I'm also looking at my reference, and I see that if I have to recommend something like omeprazole, which is over the counter, it has the potential to interact with the with one of the ingredients in the Epclusa that you're taking, which is the velpatasvir. So I would not be able to give you the. Just a moment, please. Yes. So what I'll just be giving you is I'll give you the omeprazole, the 20 milligrams. Okay. And then if you have to take it, just because you're also taking your Epclusa, I would recommend that you do not take it at the same time.
2 minutes remaining.
Okay. No problem.
So are you going to give me or no? Because I'm confused now.
So just a moment, please. All right, so I can give you the omeprazole. It doesn't interact with the food, with your medication. So I'll give you the omeprazole, and I would recommend that you can take it at the same time with your Epclusa. But the Epclusa is supposed to be administered with food so that it can also reduce the heartburn that you're experiencing. Okay.
So take it the same time as Epclusa.
Yes, you can take it at the same time. I see here that it does not affect it. So
Okay.
it can be taken as long as it's the 20 milligrams omeprazole. And yes, so you can take it with your Epclusa, and your Epclusa should also be administered with food so that it reduces the symptoms of heartburn that you're also experiencing. And so is it okay if I follow up with you in the next 2 to 3 days to know how you're doing after you have started this medication?
How often should I take it?
All right, so I recommend that you just take 1 tablet once a day. Just give me a moment. Let me still go through my reference before I give you information. This reference is a lot. Yes. So do not stop taking your Epclusa. Keep taking your Epclusa. Take it with food, and yeah. So you can take the omeprazole with it, and then some of the side effects that you might be experiencing can be nausea and vomiting. But if it gets really bothersome, then you can stop. Okay.
Okay. Time is over.
All right.
Okay.
No, what happened?
Why is so confused? Why? What is the reason?
Yeah,
Why?
because
Okay,
when I open,
I have a concern. Why you didn't tell me take the omeprazole in the morning, 30 minutes before breakfast? That should cover the whole day. And Epclusa just separated by 3 hours or something to prevent any interaction. That's it.
Yeah. So you know what happened when I looked at the page 19. I saw that it doesn't really interact as long as it's 20 milligrams, because I read here that proton pump inhibitor doses comparable with omeprazole 20 milligram or lower can be administered with Epclusa.
Actually, it's in the table, my dear. It's in the table. Okay. Concomitant drug.
Page 16.
Give me page 16. Or any
Yes.
proton pump inhibitor, or even antacid, or even famotidine will decrease the concentration of vilbetazavir. Just tell me, yes, you can take it and just separate. That's it. As simple as that. 4 hours. It's simple. It's very simple.
No, I saw the separate for antacid.
But you keep insisting. When should the PPI should be taken? When?
So
with
the PPI.
Food? With food?
No,
or
it should
after,
be taken
or after or before?
Before food.
No, 30 minutes.
Exactly,
Yes.
30 minutes before food, right?
Mm-hmm.
And Epclusa, when is the best time to be taken? With food, right?
Yes.
Exactly. So why you want to tell me take it together? Why you keep insisting to keep taking it together? No, they're not together. Yes, you can see, yeah, there is an interaction, yes, but we can manipulate the interaction. For example, usually PPI is taken early in the morning, right?
Yeah.
Even before breakfast. And then ask me when you take your Epclusa. I would say lunchtime. That's a nice regimen. Yeah, fine with it. Yeah, don't tell me take it with Epclusa. It's fine. No, because it's not fine. PPI should be taken before food, not with food.
Okay.
Right?
Yes, perfect.
Yes, and what is the reason of my heartburn? The method mainly. I keep insisting mainly the methadone. You have to when should I take the methadone? Right? You have to tell me early in the morning, at night, whatever. You have to ask me, right? For example, I will tell you, okay, I come here like every day at 11, 11 a.m. in the morning. So okay, no problem. Even since this is the reason, take it like let's say for example, take the PPI like at 10 or something, and then take your breakfast 30 minutes after, and then you can take your methadone. It should be covered the whole day. That's it.
No problem. Thank you.
Okay. No
Thank
problem.
you.
Okay. Omeprazole is a Schedule 1. We'll need a prescription for it. Okay. What's that guy name or this lady?
Schedule 1? No.
Let's schedule Bucky. His name is, or her name is Bucky. Okay, so I recommend you, same I recommended for Muhammad. You have to go to a pharmacy for volunteering for some time.
Yes.
Okay.
Omeprazole is over-the-counter medication.
There is, yes,
Yes,
there is.
even omeprazole.
Exactly. There is Nexium and there is omeprazole, like the 20 milligram. That's behind the counter. It's not the 40 milligram, which is like need the prescription. Okay. So I recommend you to go to volunteer in a pharmacy too. Okay,
Should
guys.
we tell him don't use it more than 2 weeks?
You can.
Because
Yeah,
over the
definitely
counter.
you can. Yes, definitely you can. Definitely you can.
Come in my pharmacy. I'm Herman. Come in my pharmacy.
Sorry?
Oh, yes, Herman.
I say I'm Herman. Come in my pharmacy.
Where are you located, Herman Deep? Are you in Ottawa or what?
I bet in Brampton.
I'm in Brampton.
Yo, see, I told you, you're in Brampton, 100%.
Brampton.
Yeah. Actually, yeah. My shoppers is just a walking distance from my house. So yeah.
Okay.
Sounds good. Okay, let's get back to station number 2. Who's next?
I have a question regarding this station. On behalf.
Yes, go ahead.
For omeprazole, it covers for 24 hours for the acidity. So it will decrease the concentration of the drug eventually. Can we just recommend an antacid instead? Just to cover like a short period of time?
Same thing. It says here as per recommendation, it says you can separate for 4 hours or something.
Okay.
Or you can, or you can recommend the antacid. Yes, you can. My concern actually for our candidate is like she said, take them together with food. That's my concern. It's either like take antacid, no problem, and separate, or she can separate. ما فيش مشكلة يعني. بس هي قالت كل حاجة، يعني هي جابت الغلط كله وحطته في حتة واحدة، فاهم قصدي؟ خد الإبيكلوزا with food with the PPI. That's the worst scenario. تمام؟ ماشي يا باشا.
Okay. Where are you gonna post the recordings? Okay, we're gonna post it on YouTube, the PharmaFree YouTube channel. I'm gonna, one moment, I can share you the link now if you like. Do we have the and we will post it as well on the RX platform, RX course platform. Okay. One moment. Very good. So I shared you the YouTube channel here. On previous sessions as well. Okay. So let's proceed. Next, I can see Ahmed Higazi.
Yes. Ahmed Higazi. Yes.
يلا بينا أبو حجازي.
Yes, here.
هو أنت اللي إحنا بنسألك كل مرة أنت منين، بتقول لنا من اسكندرية، أنت من سيدي بشر والقصة دي.
لا I'm from Cairo. لا أنا من كايرو.
طيب. بس في حد كل مرة بنسأله أنت منين يقول لنا من اسكندرية.
هو ساكن جنبي غالبا.
أيوه كل مرة يطلع ساكن جنبك وأنا مش فاكرين اللي حصل إيه. طيب أوكي. Okay. Here we have 2 references. We have station number 2 reference. I'm gonna send it to you now. CDC products. No, it's not. Oh, it's over the counter. Excuse me. It's OTC products on the table. Okay. You have over the counter products on the table. Here it is. Okay. And you will have the reference now. I'm gonna send it to you.
Okay.
Station number 2. one moment يا باشا، بعتهولكوا هنا وخلاص. Here you go.
Okay.
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 Azuri, please watch the time.
Okay, I did. Okay, 30 minutes. Yeah, 30 seconds. Yeah.
Okay.
30 seconds. Okay, you have 30 seconds to go through the reference, etc. Hi, can I speak to the pharmacist?
Okay. Hi, I'm Ahmed. I'm the pharmacist in charge today. How may I help you?
Yes, Ahmed, how are you? My name is Einstein. I have like a question, please.
Okay,
It's
sure.
been like a while. Yeah, it's been like a while that I'm not feeling good. Okay, I have difficulty sleeping in the night, and I don't feel like I'm in a very good shape. I don't know what's the problem.
Okay, this should be disturbing, Einstein. I will try to help you, but first we need to ask you a few questions. Please have a seat in our private counseling area. Anything will be discussed will be private and confidential. So tell me, Einstein, I can see from your profile here that Albert Einstein, 44 years old, is correct?
Yeah.
Okay. So since how many days it started difficulty in sleeping?
Yeah, since I started the citalopram, the new antidepressant, the doctor told me that it should help me sleep well, but I don't know. It's gonna take time to give an effect about that or what. But it's been like only 4 days that I started it, but I'm not feeling too good. I have difficulty sleeping.
Okay, sure. Fine. So do you feel any urge to move your legs? Any unpleasant sensation in the leg?
No, I don't think so.
Any difficulty in breathing, gasping? You are like snoring or something like this during sleeping?
No.
Okay. Any other symptoms that you are feeling that I should be aware of?
No, it's only difficulty breathing, and I think that I have the sensation that I'm overvolted. You get what I mean?
Okay.
Like yeah,
You are
I have so many energy.
like hyperactive. Okay.
Yeah.
Okay, I can see from your profile. Can I see the profile again, please? That you are on rosuvastatin, 20 milligram. Are you still on rosuvastatin, 20
Yeah,
milligram?
every day.
Are you taking it regularly?
Yeah.
Is your cholesterol level controlled?
Yes, it's fine. It's accepted.
Okay. And also I can see that you are on citalopram, 40 milligram. You told me 4 days ago you're taking it as prescribed. However, you do not feel you feel like hypervolted or hyperactive and difficult in sleeping. So Vyvanse, I'm seeing also that you are an injection once daily. Are you still on this?
Injection. It's one tab. Oh yeah, it's one tablet. Excuse me. No, it's one tablet, not injection.
Okay. And may I know why this is prescribed for you?
Vyvanse for ADHD.
Are you taking this regularly?
Yeah.
Okay. Any other medical conditions?
No, that's it.
Any other medications from other pharmacy?
No.
Any over the counter?
No.
Do you have any allergy?
Yes, peanuts.
Nuts. Okay.
Peanuts, yeah.
Nuts. Okay. Tell me, Einstein, did you try anything for the sleeping problem?
Would you repeat that?
Did you try anything for the sleeping problem? Have you
No,
tried?
not yet. Actually, no, not yet.
Have you informed your doctor?
No.
Okay. If there's anything that make it better or worse?
No.
Okay. Also, I need to ask you a few questions. Sometimes lifestyle can affect the way medication can work. May I know, do you have caffeinated beverages?
No, about 1 or 2 per day.
1 or 2 per day. And what about the alcohol?
Occasionally.
Occasionally. Okay. Do you smoke, Einstein?
No.
Okay. Thank you. Just give me some time to check my reference, and we'll be back to you as soon as possible. Okay.
Okay, take your time. I would like to take the CPD if that would be possible. One of my colleagues told me that CBD would be
2
a good
minutes
choice
left,
for
huh?
me.
2 minutes left.
Okay, I need to thank you for thank you Einstein for this. Actually, escitalopram, it's one of its side effects that can cause difficulty in sleeping during the initiation phase, and also regarding the change in mood and the change in to give the full effect, it needs to start at least for 6 weeks. So this will take some time. So I would recommend you to be with it for a while, for some time, and please take into consideration to take your dose as prescribed by the doctor. For something to help you in sleeping, I can recommend you something to help you in sleeping. That, for example, you told me that you heard about something which is
CBD.
CBD. Yes, herbal. Actually, these kind of products is not medically tested in a good way. So I can recommend you other thing. I can recommend you Nitol. You can have 1 tablet before sleeping and every day. And if it's not working with you for 3 days, or if you need it for 7 days in a row, please contact your doctor as soon as possible.
So you're gonna give me what? Melatonin?
The sleep ease or Nitol, the diphenhydramine.
Sleep ease, yeah.
Yes.
Sleep ease.
Yes.
Okay. Okay. How many tabs per day?
You can take 1 tablet before you sleep every day, and also there are some self-care measures that you need also to try to reduce the caffeine intake for a while. Try to avoid having exercise 1 or 2 hours before you sleep. Also try to avoid having heavy meals, and try to sleep in a place which is calm and quiet, and also try to engage in a bit of social activities, which will help your condition as well and make the sleeping environment very well. Also, please be aware that after taking the sleep ease, do not operate in heavy machinery or try to drive because it can affect your alertness. It can cause some drowsiness. Okay.
Okay. Sounds good.
Thank you very much.
I take 1 tab every day, right?
Yes,
Time is up.
1 tab per day, every day. Thank you. Okay, good. Okay, my friend. I don't know. For me, it's not completely solved. You miss some points. Okay, so we have 2 choices here: either to assess the station or to retake it with another candidate. Okay, what do you think, my friends?
Assess the station.
عايزين
assess do assess عشان نلحق نخلص.
عشان تلحق تخلص. Would you like to assess or retake it? حد يتكلم من الناس؟ طيب بلاش جسولي.
assess في سنة معايا.
Assess or retake, guys. Please write
Assist,
down.
please. Assist.
It's better to see different ideas.
Okay, so we're gonna assess it. Okay. Have you noticed the problem here? What's the problem in the profile? It looks good. Okay.
Why events cannot be taken?
What? Excuse me. What? Okay. What's the change that happened to this file? What's the new medication here?
The citalopram.
Okay. And the guy started feeling insomniac since about 4 or 5 days ago when he started the citalopram, right? Correct. So most likely the problem is the citalopram. Okay.
Yes.
Number 1, first question to ask is, at what time of the day are you taking citalopram?
Okay.
Okay, you didn't ask this one. This is number one. Number two, what about the dose? The first thing to ask, or first thing, yes, to get attentive to with is the dose with antidepressants. Okay, we have to go slow with antidepressants. This is the maximum dose here, 40 milligrams. He's taking 40 milligrams, and yes, what makes the things worse is that he's taking Vyvanse as well at 50 milligrams, which is high dose. Okay, so most likely this guy may be at risk to have serotonin syndrome. He started he started to develop some symptoms similar to serotonin syndrome. He's energetic, he doesn't sleep, and you didn't even go near or far from the serotonin syndrome. You didn't ask about anything related to serotonin syndrome. You may ask him about do you feel any fever or hyperthermia or something like that? Do you feel dizzy? Do you feel like drowsy? Anything? Or maybe have something that could be relevant to serotonin syndrome or not? No, you didn't mention anything about it. Okay, so this is number two, and here's the trick: the dose is not correct. Okay, the timing of the dose, we don't know at what time of the day he's taking it, morning, evening, we don't know. Okay, so the first corrective action to take is to correct the dose. You can decrease the dose by yourself, or and notify the doctor, or you can call the doctor if you would like to modify. But here, I don't know what about the other provinces, but like a judgmental situation here, and for the safety of the patient, you have to correct the dose without getting back to the doctor, without even getting back to the doctor, because this is an initial dose, right? You have to 20 milligrams is the initial dose of the citalopram. Some patients start at 10 as well. تمام؟ فانت هنا مش لازم ترجع للدكتور عشان تقول له اقلل الدوز ولا لا، لا طبعا لازم طبيعي انك تقللها لوحدك يعني. تمام؟ طيب. So what about the other the over-the-counter medications here? Sleep ease would be the right action, would be the right choice. What do you think? Would you prefer sleep ease or melatonin or CBD, valerian? Okay, the safest one is the melatonin. Melatonin is the safest, especially the guy is taking two neuroactive medications here. He's taking two neuroactive medications, citalopram and Vyvanse. Okay, so it's, as much as you can, try to avoid sleep ease. Also, the counseling about the sleep ease. You told him take 1 tab per day and that's it. This is a correct counseling?
I lost the time. Yeah, it's timing بس كان.
ايه يا باشا؟
لا التايم بس فأنا I wanted to.
طيب ايه الكونسلنج بتاعك؟ لو سليب ايز هتقول له ايه؟
برضه يعني we will take 50 milligram before you sleep 30 minutes before sleeping وهنتكلم على ال adverse events and then the monitoring نعمل دوزام يعني الدوز والonset of action within 30 to 1 hour 30 minutes to 1 hour and then we'll continue.
Okay, so we're gonna continue every day, right?
Before sleeping every day, yes.
Okay, is there a maximum duration of treatment for the over-the-counter?
Yeah, I told using it for 3 days without, and if you have to use it 7 days for 7 days consecutive days, you need to talk to your doctor. This is I told.
Did you say that?
What?
Did you mention that?
Yes, I mentioned.
الله ما سمعتهاش دي. Okay. تمام حلو كويس يا باشا انك قلتها. Okay, that's it. So بس this is a station. Okay, correct the
If the
dose.
patient has serotonin syndrome, is it an emergency situation or just severe symptom? Serotonin syndrome.
Emergency situation, it depends on the symptoms actually. It depends what type of symptoms he has. If he developed convulsions, for example, some patient may develop convulsions and seizures and something. In this case, no, he has to go to the emergency at once. But if only like insomnia and some hyperactivity and something like that, and maybe some fever, not fever, hyperthermia, this not like an emergency situation actually. It's not like a very emergency situation. No, it's not the same case like neuroleptic malignant syndrome, for example. Neuroleptic malignant syndrome, this is an emergency case. But serotonin, it depends on the symptoms. Okay.
Maybe, move on.
Okay, very good. Any questions? Is it clear? Do you have any comments? Would you like to add anything? Would you like to ask about anything here? Type.
Yes, doctor. If I'm not comfortable to decrease the dose or change the dose, what is the other option? To send him to the doctor, or like if I fax the doctor, it will take maybe 1 day.
Okay, no problem. You can do that, but this is not in the patient interest. It's not in his best interest. There is no reason to let him continue with the high dose while he's feeling like uncomfortable, right? There is no reason for that. يعني تبقى سايباه شايفاه كده واخد دوز عالية وشغال وانت بتقولي ما فيش.
Is that in our scope of practice to change the dose the first treatment of depression?
انت مش هتغير الدوز، انت هتصلحي الدوز.
المفروض
correct. You will not change the dose. You will not keep him at 20. You will correct the initial dose only. You will correct the right dose for citalopram if you open the monograph, if you open your reference.
Yes, starting dose is 10-20 and the maximum dose is 40. But if this new prescription, I can fix it. Like I can say the doctor it's too high dose, and my reference says that what's your recommendation by fax. But he is already.
Yes, this is your professional judgment, and your professional judgment here, it's clear. There is no need to be hesitant or something. You have the reference and you have the right action. You are not a drug seller. You're a pharmacist. You're not only sell a drug and that's it. Okay, you have to take your own actions here.
In Ontario we can do it, doctor.
ايه in Ontario ايه اللي بيحصل معلش؟
لا انا بسألك انت في اونتاريو لو البريسكريبشن دي اتصرفت وجات لك تقدر تصلح الدوز بعد ما اول مره
it doesn't matter in Ontario او في اي حته. It's again زي ما محمد بيقول كده be confident ان انت you're gonna start at low dose any antipsychotic you're gonna start at low dose تمام و go stepwise slowly. If you're gonna win himself, he like any antipsychotic board, he cannot stop it like cold turkey. He gonna like win himself step by step. If you're gonna add a new medication, it's in every day. Get a prescription, تمام. Stop this one.
Yeah, that's my.
Stop sertraline and start escitalopram. Doctors doesn't care about like switching parallel, switching stuff like that. They don't care about it because it's your job. So feel confident to do it. عادي جدا. It's fine. Feel confident if you got a prescription on like 20 escitalopram. No, tell him take half for like a week and then you can increase it to 1 tablet. عادي جدا. It's totally fine. It's not about Ontario. It's about the right, like the right.
ايوه يا دكتور انا عارفه لو نيو بريسكريبشن جايه لي اوكي هعمل كده، انما دي البريسكريبشن دي راحت له خدها 4 ايام هنزله للنص او الربع مش هيحصل له withdrawal symptoms مثلا؟
because he experiencing side effects عادي جدا. Yes.
اوكي تمام.
he's experiencing side effects. الراجل عشان واخدها غلط بقاله 3 ايام. انا جالي مره روشته، ده ريل لايف سيتويشن. جالي مره روشته على الدكتور ما بينامش الراجل، تمام. البيشنت هذا انسومنيا وعنده ديبريشن، وعشان خاطر مراته كانت توفت. اوكي، بس توفى. الدكتور كتب له 100 سيرترلين، 100 سيرترلين. قمت انا عاملهم ايه؟ 25s
25.
تمام. قلت له ابدا ب 25. عملتهم 25. ابدا ب 25 فور 1 ويك، بعد كده 50، بعد كده اب تو، بعد كده 1 ويك، بعد كده تكتب 100 if tolerated. تمام.
اوكي
بس
تمام.
خلاص it's totally
اوكي
fine.
تمام.
Yes, fine. Yeah. Like feel confident
شكرا
to
يا
do
دكتور.
to use your expanded scope. It's fine. If you're not
معلش بس أنا
comfortable
عندي
with doing,
comment.
yeah, shoot it.
So you're correcting the prescription if it's like a first time you're receiving a prescription and you're gonna correct the dose. But if he's coming after dispensing, like he's coming back,
how
يا
long?
دكتور.
How long?
ولنفرض السيتويشن ده دلوقتي انا هقلله الدوز، بس I cannot issue a prescription مثلا. I cannot issue a prescription.
You're not issuing half it. You're not issuing a new prescription. He has
مش ما هو
40.
في السيتويشن ده you can have it, بس في other situations you wouldn't be able to have it. يعني السيرترالين مثلا لو مصروفه 100 مللي جرام،
زي السيرترالين اللي انا كنت بقول عليها
مثلا لو
لا السيرترالين اول مره يا دكتور، اول مره you can tolerate it عادي ما في مشكله، انما هو اوريدي خد الدواء. I think he needs to more.
مثلا جميل 4 ايام ل 100 صح كده، مش هينفع يقسمها صح كده. خلاص قولي للدكتور we can fax the doctor to decrease it we start slowly. عادي جدا مفيش مشكله.
بالظبط كده، لكن مش احنا اللي
Yeah, we can fax the doctor to start on lower dose. That's because it's too much sometimes. يعني يبدأ على 50 حتى too much. We can fax the doctor to start on low dose. بس خلاص. Yeah, مفيش مشاكل.
تمام.
ومحمد برضو عشان to clear any confusion. محمد he practice in Quebec. In Quebec they have the capabilities way more than in Ontario. So he can do this in Quebec. تمام. that's why like انا عارف هو جاي منين، فاهمه؟ فهو بيتكلم بالاسلوب ده، قلبه جامد شويه عشان هو في كيباك he practice that way. in Ontario احنا شويه restricted. تمام. فانا فاهم فممكن جدا نقول لو انت يعني الامتحان في الاخر it's a federal. تمام. ف if you want to play it safe you can say okay this is high dose, I will fax your doctor to change it, and now there is a capability هنا there is a tablet you can have it until you get the confirmation from the doctor, because يعني you have to highlight البروبلم هنا يعني. تمام. بس هنعملها ازاي بقى دوت مفيش مشاكل يعني it's okay. في الامتحان they are not يعني very as long as you highlighted the DTP خلاص انت فهمتي الدنيا ماشيه ازاي يعني. فاهماني؟ فانا يعني مفيش مشكله. ماشي.
Okay, so let's proceed. Station number 5. David is raising his hand. يلا ديفيد خش. انت وارمي يا ديفيد، وارمي في سيشن واحده. ربنا يخليك. يلا بينا.
اوكي.
جزولي يلا.
This my station. Okay.
دكتور معلش. الو دكتور. معلش انا ليا سؤال بس في الستيشن اللي فات. هو انا كصيدلي ممكن ان انا اغير الدوز تبقى انيشال دوز زي ما حضرتك قلت، يعني ده من السكوب ماي براكتس.
انت في كيباك ولا في اونتاريو؟
ايه يا دكتور. الو
صديقنا في كيبك.
احنا لسه كنا بنجاوب ده كله يا ارمي. ما هو جازولي كان بيجاوب
معلش
كده.
انا عاوز بس جمله، انا عاوز جمله واحده. هل
انا في رايي المتواضع اللي هو ممكن يبقى غلط طبعا، بس برضه ممكن يبقى صح. انت هنا انت بتصلح الجرعه ما بتغيرش جرعه. الراجل بياخد جاي على 40، انت بتصلحها بترجعه ل 20 لمده اسبوع، بعد كده يرجع ل 40 تاني. دي مش عايزه اي حاجه، دي بقى لو بالكتير خالص هتعوز بس ان انت نوتيفيكيشن للبريسكرايبر وخلاص. ذاتس ات. اوكي. بس انت عشان في ناس ممكن تبقى قلقانه شويه وخايفه او لسه يعني ما دخلتش في البراكتس كده بصدرها، فبتقول لك لا او بتاع انا هبعت للدكتور الاول. ابعت للدكتور الاول مفيش مشكله، بس انت لازم تاخد قرارك بسرعه. ما انت ما تبعتش للدكتور وتستنى اسبوع وتسيب العيان اسبوع على 40 مللي جرام لغايه ما يجيله سيروتونين سيندروم، وتقول اصل انا كنت خايف اغير الجرعه. طب ما انت في الاخر انت اللي مسؤول برضه، ما انت هتتسأل. ممكن لو العيان عايز
يعني في الحقيقه دي من صلاحياتي في الحقيقه.
فين يا باشا؟ انت مش في
في
كيمياء؟
الحقيقه
ما
في
بتنزلش
الصيدليه عموما.
ايوه يا عم في الحقيقه، ايوه انا
انت
بيجي
ليه
لي كتير جدا
شويه
على فكره. باي ذا واي يعني الناس اللي هي اللي انا بيجي لي روشتات كتير جدا، خصوصا من الجي بي مش شطار في الحته دي. السايكاتريست بيبقوا يعني بصراحه يعني they know what they're doing. يقول له مثلا ايه، يدي مثلا مدي اسيتالوبرام، ما نفعش الاسيتالوبرام، يقول له وقف وخد مثلا فيلافاكس. تمام كده، تمام. فانت كدورك هنا ايه؟ لا، مش هيحصل الكلام ده. انت يعني انت كنت على 20، هناخد اسبوع 10 وتعمل بارل، هناخد بعد كده 37.5، بعد كده هنزود ل 75. انت لازم تعمل كده، تمام. معظم السايكاتريست دي تيك كير اوف ذس وان اوف ذس بوينت. الجي بيز مش بياخدوا بالهم، مش يعني بيجربوا مره واثنين، وبعد كده لو العيان ما نفعش معاه بيقوم محوله بقى، يقول لك لا ده كيس صعبه، بيحولوا على ايه؟ على سايكاتري، تمام. يس اتس يور جوب يا ارمين انك تعمل كده عادي جدا. في عندي انا برضو عندي حد بيحب لما يبدا بري جابلين بيبداوا ب 150، تمام. ده كتير جدا، 150 ده كتير جدا، ده بيدروخ اصلا جامد جدا. فانا دايما بقوم ايه يعني ماشي بدي خمسينات، تمام. وهو ليه بقى بيعمل كده؟ هو اسطمبة ايده كده، هيز براكتس يعني هيز هابت اوف بريسكرايبنج، هو الموضوع ده كده على طول ايده واخده ان هو بري جابرين 150 بي اي دي. ده تو ماتش اصلا انك تبدا بكده، تمام. والراجل ساعات بيبقى سايق ومش عارف ايه وبتاع، بيدوخ اصلا. فانت خلاص انت فاهم بقى الدنيا ماشيه ازاي. فبتبدا بلو، بعد كده بتقول له لا خد لنفسك اسبوعين ولا حاجه لحد ما جسمك يتعود. اصلا ساعات بيبقى اصلا يعني 100 اصلا بيبقى اتس انف، انت فاهم. طب انت بتعمل كده ليه؟ اتس يور جوب انك انت تعمل كده اصلا، يعني اتس يور رايت انك انت تعمل كده، بس اتس يور ريسبونسابيلتي. فاهم قصدي؟
تمام.
احنا بنعمل كده طول النهار والليل اصلا، يعني في الصيدليه انت ما بتعملش غير كده.
طيب في الامتحان هقول له ان انا هعمل كده وفاكس الدكتور، وفي الامتحان هقول له ان انا هعمل
يس
كده
انت
وفاكس
دي بي
الدكتور.
اصلا يا باشا. ايوه طبعا، ايوه ما تخافش يعني عادي، قول له انا هعمل كده وهفاكس الدكتور. ايوه بالظبط.
تمام.
Okay.
Yeah.
So station number 5, David, are you ready?
Yes, I'm ready.
جدولي يلا.
Let's start. Yeah.
One moment, guys. One moment. We're gonna start the time. Okay. Yeah, you didn't know there's a reference here. One moment, Ivish.
Okay.
Station number 5. Yes. Yes, we have reference. One moment. I will send it now to the WhatsApp group. Okay.
تمام.
Okay.
عايزينه على الزوم. Okay. Yes.
ماشي يلا بينا.
Okay.
Reference here to the Zoom. Yes. Let's go, my friend.
Okay.
Yes, go ahead.
Hi, may I speak to the pharmacist, please?
Hi, I'm David, the pharmacist today. How can I help you?
Hi, David. How are you doing? Actually, my doctor told me that I need to pick up like Big Light.
Okay.
Behind the counter.
Okay, I will do my
Do you
best.
have it?
Okay, I will do my best to help you. First, have a seat. How can I address you?
My name is Muhammad.
Okay, Muhammad. And what's your age?
I'm 35 years old.
Okay. And may I ask you why the doctor tell you to have Pedialyte?
He decided to have me get a colonoscopy in 2 weeks.
Okay. Is this the first time to do that?
First time, yes.
Okay. Did you tell you anything about the colonoscopy?
No, he didn't. He said the pharmacist would explain to you how I'm gonna take it, what's gonna happen when I take my big light.
Okay. I see in your profile you have diabetes and you are taking metformin.
Yes.
Okay. And may I ask you why are you taking apixaban?
AFib.
AFib. Okay. And you have high blood pressure and you are taking a couple of medication.
Yes, it's controlled. It's controlled.
Yes, it's controlled.
Yeah.
Okay. Okay. Very good. May I ask you about do you take any over-the-counter medication?
No.
Do you have any kind of allergy?
No allergy now.
Okay, and may I ask you about your lifestyle? Do you drink alcohol?
No.
Okay. Okay. Okay, I will check my reference and come back for you.
Okay.
Do you have any kind of valve? Do you have valve? You tell me that you have atrial fibrillation. Do you have valve replacement or something?
I do, yes.
Okay. You have valve replacement.
Yes.
Okay. Okay. Does the doctor tell you that he will do bulbectomy with the colonoscopy?
What? Do what? Sorry?
Okay,
Do
you
what?
tell me it will be in 2 weeks, the bulbectomy. The colonoscopy will be in...
Colonoscopy. Colonoscopy,
Yeah.
he said. Yes,
Yes.
he want to check my colon if I have a polyps or what. That's it. Or no.
Okay. Okay.
Okay, are you giving me the my big light? Because I don't know why you are quiet now.
It's only check my reference.
Oh, okay,
I
okay.
check my reference and I'll come for you.
Okay.
Okay. Does the doctor tell you to discontinue any of your medication?
He said the pharmacist will explain to you everything.
Okay, you need to discontinue your apixaban 48 hours before the procedure.
My apixaban 48 hours. Okay, I will do that. No problem.
Okay, and the metformin you can take half of the dose the day before.
Okay.
And I will continue after eating, after the procedure.
After eating, after the procedure.
Okay. Yes. Okay.
When should I eat?
Before the procedure or after the procedure?
I don't know. I'm feeling confused.
Before your procedure, you need to discontinue any if, as I told you, the apixaban 48 hours, and you told me that you are not taking any over-the-counter, any products over the counter.
I'm not taking any over the counter already. You asked me.
Yes.
I told you I'm not taking any over the counter.
Okay, I would like to tell you only before the procedure, not to eat any something that is bulky or like fibers or something. Okay. And I think you will need to be fasting for at least 6 hours before the procedure. So as I told you, you can take half the dose or skip the metformin and return it after eating, after the procedure. And for the Bixaban, you will return it 2 days after the procedure. Is it okay with you?
Okay. Yes, okay, definitely.
And okay, the Pedialyte, you will take it for sure, because if you have any sign of dehydration.
I'm not taking Pedialyte. I'm taking Bipig-Lite.
Bipig-Lite?
I'm not taking Pedialyte.
Okay, Bipig-Lite. Okay, this is medication. You will use it in order to evacuate your and empty your colon before the procedure. So you will take it. Does the doctor tell you how to take it?
Okay, again, he told me that the pharmacist will tell you about how to use it.
Okay, you will use it. You will take the wall of it, and you will. It's with electrolyte. You will take the whole sachet.
The whole sachet. Okay.
Okay. With water, you will put the sachets with water, and in order to evacuate your colon.
Okay.
Okay.
What should I expect?
You should expect. You should be near to the washroom, because you will go. You will evacuate all your colon content. So become near the washroom.
Time is over.
Okay.
Okay. Are you okay? Okay. Thank you.
Thank you so much. Thank you so much.
You're welcome.
تمام.
ماشي. Should anyone like interested to try one more time? Or you want me to assess the station? Safa, do you want to start? Maisa, do you want to
assess? Please
assess? Okay,
yes.
assess. Okay, no problem. Okay, so Mr. David, give me wrong information. What is the wrong information do you guys think?
متهيألي ان انت عايز تعمل بريدجنج بقى. انت المفروض تعمل بريدجنج ولا ايه؟
Bridging. Okay. Bridging. ايه يا ديفيد اللي انت بتقوله ده يا ديفيد؟ ديفيد انت بتقول ايه؟ انت صايم لسه ولا ايه؟ بجد والله
لا
انا مش مصدق نفسي. انا وداني اصلا خربت من كذا حاجه قلتها.
ماشي.
طيب انت اول حاجه first of all did you read the reference؟
أقول لك معلومة صغيرة. ديفيد كان باعت لي سلام من عماد زكريا من كام يوم.
بس كده خلاص انا كده فهمت. بس كده شكرا.
كان مع عماد زكريا فعشان كده مش مركز.
بس خلاص انا فهمت والله. خلاص كده شكرا على كده. بص مستر ديفيد, did you read if you read the reference? Okay, I know by practice you just shoot it to any patient. Okay, there is a colonoscopy, you have to stop any blood thinner. This is wrong. This is totally wrong. Okay. So you have to know first why we use this blood thinner. If you check, if you use Eliquis for AFib or high risk of thrombosis, you should not stop the blood thinner. Okay, this is number one. So you give me a very wrong information because you took it for granted and you said okay, and I believe that's what you guys do in practice. A colonoscopy equals stop the blood thinner. No, it's not like this. You have to know first, like why he uses blood thinner for. So I told you it's an AFib, and you shouldn't stop any blood thinner using because of the AFib. Okay, that's number one. Number two, you didn't counsel me on the Bipig-Lite. You keep telling me that's an Pedialyte or something, right? You told me that's a Pedialyte once.
Yes.
Yeah, it's not a Pedialyte, my friend. It's Bipig-Lite. Bipig-Lite, okay, it has polyethylene glycol. You have to counsel me like this. Bipig-Lite, it has a polyethylene glycol plus bisacodyl tablet. Okay, so it's two medication in one. Both together has to be taken. Okay, to evacuate your intestine. Okay, so to help the doctor to see if there is any kind of polyps or something. As simple as that. How are you going to use it? The beta-caudil is a tablet. You can take it orally, and the polyethylene glycol comes in sachets, powder. Open the sachet, put it in water, and then you're gonna drink it. تمام؟ وشكرا. أفلا المؤمنين شر القتال على كده. خلصنا على كده. You can. What should I expect? أنت قلت لي you should expect to become to the washroom. طبعا جملة إنجليزية غير طبيعية عالمية طبعا. تمام. You should expect. أنت يعني ماشي أنا فهمت قصدك يعني I know what you mean. But you have to put it like in a proper way because the patient will show that he doesn't understand. تمام. يعني شباب your English should be clear. I didn't ask you to be like natives. Like it should be like have a clear and a short sentence to like so whoever in front of you understand what you're saying. Okay. يعني لازم تبقى مرتب في الكلام يعني. تمام. You can either say you should become like near any like stay at home because you're gonna have like a kind of diarrhea because you're evacuating your intestine. تمام.
Nausea.
ماشي أنا فاهم كده أنا هيجيلي ده.
Happens a lot. Yes, happens frequently with biblight. Nausea.
مثلا yes bowel movement you're gonna increase your bowel movement مثلا لو أنت عايز تقول لي كده ف you should be staying at home مثلا أو كده ماشي.
You
أنا
didn't
فهمت
mention
قصدك.
about the fridge, right? To keep it at fridge.
Yes.
Keep it in the fridge.
فريدج ولا بريدج؟ أنا ما سمعتش بصراحة. قلت لي بريدج أنت قصدك فريدج؟
أنا قصدي fridge.
ريفريجريتور يعني ماشي. طيب
هو مش ده يا دكتور اللي هو الكيس اللي احنا بنفضيه على اللي هو لتر ميه وكده واللي هي كل اللي هي تقريبا كل 10 دقائق بنشرب منه اللي هي كميه
شفت
معينه.
بقى الدنيا سهله وبسيطه زي عبد السلام. ما اعرفش هو ديفيد دخلني في الحيطه. ما اعرفش قاعد يقول لي مش عارفه ايه ومش عارفه ايه بالظبط كده. هو ده. وقال لي بيديا لايت وقال لي حاجات غريبه كده. تمام.
هو سهل جدا البتاع ده.
الموضوع سهل يا شباب ماشي. هو بس التريك يا ديفيد ان انت بتبقى عارف. انا فاهم الناس كلها بتقول وقف البلاد ثينر. لازم تعرف يا باشا البلاد ثينر وات از ذا ريزون فور ذا بلاد ثينر. لو هاي ريسك ما ينفعش توقف البلاد ثينر. تمام. as simple as that. ماشي يا ديف.
اوكي.
قريت الريفرنس يا ديفيد في الستيشن؟
لا ما قراش طبعا. ما قراش طبعا.
لا قريت.
قريت كمان يا ظالم. طب انا بحاول الاقي لك عذر يا راجل يا طيب.
اول ما عملت في القعده شكله كده.
ماشي يا
في
حبيبي.
حاجه يا دكتور في الريفرنس بتتكلم على اللي هي باقي الادويه هنعمل فيها ايه؟
باقي الادويه تعمل فيها ايه؟ لا ما تعملش فيها حاجه زي ما هي. اصل هو قاعد يقول لي هتصوم قبلها بيومين وهتاكل بعدها ب3 ايام. طبعا الكلام ده كله في
This is a very minor procedure.
It's a very minor procedure
It's not
اصلا.
invasive at all. It's not invasive.
يعني مش
تمام.
بيأثر على اي حاجه.
ولا اي
الميتفورمين مش
حاجه
لازم
واحده.
يقف فيها اي حاجه من الكلام ده. مفيش كلام
بيدخل
ده.
انبوبه. هو بيدخل انبوبه في الريكتم وبيطلع الانبوبه بعدها ب 20 دقيقه ماكسيموم. بتقعد 20 دقيقه
تمام.
بس ما فيهاش
بس
حاجه.
كده ماشي.
حاجه عبيطه يعني.
فكل اللي قاله ديفيد طبعا ما تصدقوش لانه مش صحيح. ماشي.
اوعى تصدقني يا ابني.
استحيل السيزون صح اقول عكس اللي قاله ديفيد.
ماشي.
طيب ستيشن نمبر 3
بالظبط كده. نمبر 3 ولا 6؟ انت معانا 3.
ميسا and صفاء. يس. مين رفع ايده الاول؟ ميسا وصفاء.
ماشي.
اوكي. I think صفاء مش عارف مين بصراحة.
Yes, okay, me.
Any one of you guys? Okay,
Safa.
Let's go Safa.
Okay.
Okay, my friend. No reference provided, but you have over-the-counter medications available on the table.
Okay.
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 Okay, one moment. Let me adjust the time. One, two, three. Let's go.
Okay. Hello, I'm Safa, the pharmacist. How may I help you?
Hi, Safa.
Yes.
I need your advice, please. Okay.
Yes, okay, for sure. I will do my best to help you. How may I
please,
address you?
you can address me ست Abuha. Yeah.
Okay. What's your concern?
Yeah. It's been like 1 week now that I feel burning sensation in my eye when I apply the eye drops. Usually I apply this one that you have here. I don't know what's name. Yeah, refresh tears. This one.
Yes.
You
I'm
put
so
it.
sorry to hear that.
Oh, no problem, my friend. I apply. Yes, I put it like 4 or 5 times daily, every day, because I have
Okay.
a dry eye, and that's it. But it's been like 1 year, 1 week now that it burns. I don't know why.
So, okay, you start to use it 1 week ago, every day.
No, no. For this eye drops, I'm using it since about 4 or 5 months. But
4 or 5 months.
1 week ago, it starts to burn.
Okay.
Burning
Okay, for sure. Okay, I will address that. And to assist you better, can you tell me more about symptom? Is there any other thing other than burn?
No.
Just burning.
Yep.
Okay. Do you use any other medication other than this?
Medication? No.
Do you have any other any other medical condition?
No.
Do you have any allergy to anything? To food, medication?
No, not usually. No.
Did you use any over-the-counter medication other than this drop?
No, for my eyes, only that.
And anything over-the-counter like atenolol, Advil, mineral
Yeah, I
herbals?
use them. Yeah, I use them sometimes.
Okay. Okay. So can you just give me 1 minute to collect my thought? I'll get back to you.
Go ahead, Safa.
Thank you. So did you use the same drop for 3 to 4 months? Or every month you buy another drop?
Same drops.
The same drop you use it 3 to 4 months?
Yeah. I was comfortable to it.
Okay. So yes, maybe that's the reason, because the drop it's usually expired within one month. And
No, I changed the bottle. No. I
you
just
changed
bought
the bottle?
a new. Yeah, I bought a new one, but the same type of the drops. The
And is
same.
it in one eye or two eye you are using it?
Yes, 2 eyes.
Okay, just give me 1 minute.
No problem. Hello, you still here?
Yes.
What are you doing?
I'm just thinking. Because you are taking the drops for a long time, and it's because this medication is contain preservative. Okay, so if you're using this drop for a long time, as you're using it for 3 to 4 months, so that's the preservative is affecting your eye because you're using it for a long time. So it's the preservative could cause toxicity to your eyes if you're using it for a longer time. So that could be the reason for that. So are you using are you using the laptop the whole day? Can I know the reason why you have a dry eye?
2 minutes remaining.
Okay.
Yeah, you want to know the reason?
Like, do you use a laptop a lot?
No, I put the contact lenses.
Okay. So are you putting the drop over the contact lens?
No, most of the time, no.
Okay. So for that, I should refer you to a doctor for that. He can assist you better because you are wearing contact lens. So and stop this medication right now. Don't using it until you see your doctor to assist your eye better. How does that sound to you?
No, it doesn't seem good.
Because because you are wearing contact lens.
What's the
So
problem with contact lens? It's been years now that I'm wearing contact lens.
Yes, I know that, but as long as you have a symptoms and you're using this medication for a long time ago, 4 to 5 months, and usually have this preservative should not be using for a long time because it contains toxic preservatives if using for a long time. So it's better, and you are especially wearing a contact lens, so it's better to be assessed by a doctors. So if you can go to a doctor, that would be better. Can you do that?
It will be in 2 or 3 weeks.
Yes, but can you go to the doctor or not?
It will be.
I can book you an appointment with a doctor.
As I told you, it will be in 2 or 3 weeks.
What is 2 and 3 weeks?
The appointment.
Okay. So can you go to a walk-in clinic right now?
I don't know. I can try.
Okay. And if you would like, I can call you in 2 days to see how you are going on this.
Thank you so much.
You're welcome.
Thank you, my friend. So I didn't understand.
Can I retake it?
Have you referred her to a doctor? I know she's wearing a contact lens.
Yeah.
When we refer the patient, if the patient wears a contact lens, we refer him. Any patient who's wearing a contact lens, we refer him to the doctor.
I know in the table said any patient has any eye issue and wearing contact lens, we should refer.
No.
No.
No, you misinterpret that. No, you misinterpret that.
I think when we are using this medication for 5 days and the dryness didn't improve, we should refer him to the doctor.
For 5 days. Okay, guys. So this lady is using this eye drops since 4 or 5 months, right? Correct? And she's using it for dry eye. She has chronic dryness in her eye. And she was prescribed that by her doctor. Okay? The problem is, as you said, is the preservative. The preservative contained in this bottle is the main reason that caused the burning sensation on chronic use. Okay, when the patient uses this types of eye drops for a long period of time, he will start to develop burning sensation, and that's it. Okay, this is because of the preservatives, not because of the contact lens. There is no signs of infection, no other sign. Have you verified the symptom she has? She has only dryness, right? Only burning sensation. Okay, there is no crust, no secretions, no redness, no pain, no photophobia, nothing at all, no trauma. There is no one reason, not any reason I can see to refer this patient to a doctor. Okay. يعني هنا انت لازم هنا يعني برضو تشوفي الحالة اللي قدامك عاملة ازاي. واحدة عندها burning sensation في عينيها وبتاخد، انت وصلت للسبب الاساسي، يعني you get the point. قلت لها ال preservative.
Yes, I forgot to ask about red
side.
flag. Yeah.
Yes, you
Okay.
didn't ask about any red flag. You didn't ask about any red flag. No pain, no trauma, no photophobia, no etc. Okay, that's it. And this is not a not a right assessment actually. Okay, مفيش أي sign,
Okay,
no
thank
sign
you.
of infection, no sign of trauma, no sign of any red flag here. What you
Okay.
can do to change the eye drops. Just change, give her something without a preservative. This one. What about this one? Okay, it's clearly stated here. No preservatives, right? Without preservatives. Know that high-low we can apply it on the contact lens. While you are wearing the contact lens, we can apply the high-low on it. You know it or not?
Yes, yes, I know
You
that.
don't know it, right?
Mm-hmm.
Okay. ليه ما تبقاش high-low معلش؟
I was thinking to
Why
change
not?
the
طب
eye
ما هي
drop.
high-low.
Yes, I was thinking to change the eye drop, but as long as you told me contact lens, oh, I remember the algorithm refer, so that's why.
It was a trick, and I swear to God, I was 100% sure that anyone will hear the contact lens word will refer this patient to the doctor.
Yeah.
يعني أنا كنت متأكد تماما أي حد هيسمع كونتاكت لينس دي هيطلع يجري يقول لك لا روح ريفير. طب هنريفير ليه؟ مش تفهم الأول هنريفير ليه؟ هو عنده إيه؟ ما عندهاش ولا ريد فلاج، لا عندها انفكشن ولا عندها انفلاميشن ولا عندها أي حاجة. يبقى هنعمل لها ريفيرال ليه؟ تمام؟ بس ما هو ده المنطق. لكن مش هي كونتاكت لينس هي البعبع بتاعنا نطلع نجري على طول نريفير ونعمل وبتاع. لا give it a trial. يعني اديها trial مع الهايلو الأول first for 1 week or something and see how the thing will be going. If everything should be fine, went well, then okay, that's it. She can continue with Hilo. Hilo is very safe, very effective. It's compatible with contact lenses. No need to take off the contact lens and apply the drops. And it's long acting as well. So it seems like a perfect fit here, okay? That's it. Okay, this is the solution. Do not forget, please, the red flags. You have to ask before any referrals, you have to mention why you are referring this patient. This is very important, and you will be assessed on that. You will be evaluated on that. It's not only referral. Referral is not the magic word. Okay, it's not gonna end the station like that. You have to mention why you will refer. You told her I will refer you because you put a contact lens, because you wear a contact lens. Okay, it's not a reason. Okay, but I will refer you because you have eye secretion and I'm suspicious that you may have an eye infection or something like that. And moreover, you are wearing a contact lens. For that, you have to go to see a doctor. You have to be evaluated. That's it. This could be a right referral here. But not only because you put you are wearing a contact lens, I will refer you, and that's it. No, doesn't make sense. تمام؟ وصلت؟
Okay, thank you so much.
طيب. Any questions? Suzanne is asking when the class finishes. It should be. We have, I think we have one more station. If you would like to take it. We can finish the class now if you'd like. We can save the station for next time. جازولي انت معانا ولا ايه؟
معاك طبعا.
طيب.
ماشي خلاص
Station. Okay, just one moment. طيب انا لازم اروح اجيب الشاحن ثانية واحدة. ثانية واحدة هجيب بس ال okay, I'm gonna bring the charger and come back. Okay, last station. Okay, my friends. Maisa, يلا Maisa.
Yeah.
Gazuli, this session number 6.
Nice.
This one is like it's not like a new station. We did it before in one of our mock exams. Okay, and it was very tricky to some of you. But let's see. I don't know if you know it or what, but let's go and see. يلا Gazuli.
Okay. يلا.
No reference?
One reference.
One reference. ثانية واحدة. Here you go. Okay.
Okay.
Gazuli, start.
Okay.
Yes, here you go. Go ahead.
Hello, may I speak to the pharmacist, please?
Hello, I'm Aisa, the pharmacist. How can I help you?
I need a plan B, please.
For sure, please have a seat in our private counseling area. What we discuss here is confidential. Can you please confirm your name and age?
My name is Salma Haik, and my date of birth is 1995, May 15.
Okay, so Salma, you said you want plan B. Can you tell me just exactly why you need it?
I had an sexual intercourse, unprotected one.
Yeah, since when?
Yesterday.
Yesterday. Okay. So I need first to ask a few questions about your medical condition. Is that okay?
Mm-hmm.
Okay, so Salma, I see on your profile that you are allergic to pollen and peanuts.
Yes.
Any update on this?
No.
Okay, and I see that you're taking Elise 21.
Yes.
Yes, are you on Elise?
No, I stopped it.
Oh, you stopped it 45 days ago, right?
Mm-hmm.
Oh, okay, the last refill, okay. And you took Ella also 3 days ago?
Yes.
Yes, it was also for unprotected intercourse, right? And you are on escitalopram for depression? And how are you doing on escitalopram? Are you well controlled on it?
Yes, it is.
Perfect. So just I want to go back to Ella. Why you took Ella and not the plan B and not, I'm sorry?
I took, yes, I took Ella as per recommendation from the doctor unprotected incidence.
Yeah, I mean, why you didn't just come to the pharmacy and took the plan B? Why you went to the doctor?
I had the chance to go to the doctor and he prescribed me this one.
Okay, my dear. Okay, so Salma, I need to ask you about your weight.
My weight?
Yeah.
My weight is like 50 kilos.
50 kilos. Okay. I'm checking now my reference. If you have any other concern or question, feel free to ask. Okay. So before I recommend the plan B, I want you to know that because this happened to you more than once per month, it's very important that you go back to the LEs again. You're not pregnant or breastfeeding, right? No. So it's very important to go back to the contraceptive pills, because plan B or Ella are not to be used on a daily basis. You know, they are not to prevent you from pregnancy. So it's very important that you can go back to Elise again. Why you have stopped Elise?
I didn't have the chance to. I didn't have money to fill it.
Okay.
So sometimes I forget about it. So can you give me my plan B, please?
Yeah, for sure. I'm just checking my reference. Just a few minutes. Okay, so you told me that yesterday you had the unprotected sex. So I will give you the plan B, and I will also tell you that plan B doesn't protect you from sexually transmitted infection, and I also encourage you to practice safe sex with your partner. Yeah, and it's the yes. I'm just counseling you on plan B. Is that okay, Salma?
Yeah, please. Yeah, please.
Okay. Okay, so it's the first time you're taking plan B?
Yes.
Okay, so I just want you to know.
Is it okay to take it within a day? Because it was yesterday.
Excuse me?
It's okay to take it within a day from the incident, because the incident was yesterday. So it's still going to be effective?
Yeah, you can take it, yes.
Awesome.
Up to 3
Awesome.
days, it will be very effective. Yes, you can. Okay.
Okay, thank you
yes,
so much. Anything else you want me to
yes,
give
it might
to tell me
cause you
about?
some nausea. If it might
Yes.
cause you some nausea, so I prefer that you can take it with food. And yeah, this is it. Okay.
Awesome. Thank you so much, my dear.
Thank you.
That's really helpful. Thank you so much.
Okay.
Okay. Thank you so much. Do you want to do the assessment, or do you want to have another candidate to do it?
Okay. CA is saying Ella is 5 days. What do you mean? To be effective 5 days. Okay, so no need to plan
It covers
B.
you for 5 days.
Yeah.
She said.
Okay, so let's do the assessment. Okay, so Maisa is totally unsolved. Okay. Why?
So,
what is the reason? Did you check the reference?
Ella, we can't use anything after 5 days. So for 5 days, we can't use any other contraceptive methods.
Exactly, after Ella, right?
Okay.
Can you read it? Can you read it in the, please, whoever found it, can you read it for us in the reference?
That's here. Sama Sultan is sharing it.
Yes, exactly.
Use 2 different kinds of morning after pills, like Plan B and Ella, at the same time or within 5 days of each other, because they may interact each other and not all work.
Exactly. So when you give when you give 2 like Plan B and Ella, both are like morning after pills, they're gonna interact and she will be pregnant. Okay.
Okay.
So it didn't help her, giving her plan B. So what should you do here?
So 3 days ago she took Ella, so she doesn't need it, right?
She doesn't need it.
Yeah, and she has to do a pregnancy test.
Yes, or she can use IUD.
Okay.
Yeah.
Yeah, true. Okay.
That's it.
Okay. Okay.
Here's a trick, guys. Here's a trick, because unfortunately many of you got themselves entrapped in this trick. What is the ELA? ELA is effective for 5 days. Is it effective for 5 days retrospectively or prophylactically? Yes, like Sarah says. Is ELA still effective within 5 days? Yes. Retrospectively. Right, correct. So it's not protective here. It doesn't mean that I'm gonna take one tab of ELA and I will have unprotected sex for for the upcoming 5 days. Right? That would make sense. No, it prevents 5 days retrospectively. Okay? If you have unprotected sex about 4 days or 5 days ago, you can take ELA. It doesn't mean that I'm gonna take ELA now and I will be fine for the upcoming 5 days. Okay?
Okay.
Got it?
Okay.
This is a trick.
So you need the IUD.
IUD.
Yes.
So here you can give ELA or you can give IUD. Okay.
Okay. So it's referral case.
No, you can give ELA or you can give IUD.
I need the prescription.
IUD, no, IUD is like you will not insert it. The IUD, yeah.
IUD needs a prescription.
To give.
IUD needs a prescription. IUD needs a prescription.
And the ELA also, I think, need a prescription.
ELA need a prescription, Muhammad, huh?
Yes. ELA is
Okay.
guys. The solution here will be one of those. Okay, one of these options. Number one is to prescribe IUD or to give to let her go to the مش عارف بقى اسمها ايه female clinic or something like that to get the IUD. It's okay for 7 days. Number one. Number two, you can re-prescribe ELA because this is an emergency situation here. You can re-prescribe ELA and fax the doctor or notify the doctor that you give her another prescription of ELA because she had unprotected sex 3 days after. So it's like an emergency situation and you have to react. Okay, this is number two. Number three, you can give her Plan P, correct? Can we give Plan P? In any situation?
You tell us no.
ليه يا عم؟
مش انت لسه قايل لا ما ينفعش في خلال 5 ايام؟
لا ليه؟
Hmm?
For what reason I refuse to give Plan P now?
بعد 2 days يعني يا ديفيد يعني قصده يعني.
Because the plan B is contain progesterone and ELA is the progesterone inhibitor blocker. So it will not work, I think.
Yeah, exactly.
Yeah.
But here, for now, we cannot give Plan P. But can we give Plan P after 2 days? Or after
Yes, after 5 days. After 5 days, yes.
هي خدتها من 3 days.
ايوه بعد يومين يعني after 2 days. Yes.
Peak effectiveness within 3 days, but it's okay till 5 days as well. Okay, Plan B you can give up to 5 days, but first 72 hours are the peak of the effectiveness of Plan B. Okay, so here you can still give Plan P, but not to take it on the spot, not to take it today. You have to wait 2 days or 3 days and you can take it. But the risk of getting pregnancy here would be higher. Okay, so you can recommend a pregnancy test as well. Plan B in 2 days with pregnancy test after 1 week after. Okay. تمام.
ماشي يا شباب المفهومة دي؟
Yes, we have 5 days window here that you have to respect. The 5 days between the ELA and the plan B. Okay. Once these 5 days are elapsed, you can give the plan B. Yes, you can. Yes, you can refer for the IUD, no problem in that. Tamam? But the trick here is not to dispense plan B. This is number one, first trick. Second trick, ELA is effective 5 days retrospectively. 5 days back. Okay, not 5 days forward. تمام؟ الستيشن دي احنا عملناها مرة في موك اكزام، عملناها مرة برضو في اوسكي سيشن. برضو ناس كتير بتغلط فيها مش عارف ايه. اوكي. Anyhow.
Okay, شباب.
Okay, we are done for today, my friends. I think we it's late now. It's 11:30. Let's stop the recording.